Ethics is an important, inherent and inseparable part of clinical medicine. The four main ethical principles are beneficence, non-maleficence, autonomy, and justice. The principles of informed consent, truth-telling, and confidentiality are derived from the principle of autonomy. In patient care situations, it is not infrequently we will encounter conflicts between ethical principles, so let's look into each principle in greater detail. The principle of beneficence is the obligation of physician to act for the benefit of the patient. This principle calls for not just avoiding harm, but also to benefit patients and to promote their welfare. It supports a number of moral rules to protect and defend the right of others, prevent harm, remove conditions that will cause harm, help persons with disabilities, and rescue persons in danger. Non-maleficence is the obligation of a physician not to harm the patient. This principle supports several moral rules such as do not kill, do not cause pain or suffering, do not incapacitate, do not cause offense, and do not deprive others of the goods of life. The application of non-maleficence is for the physician to weigh the benefits against risks of all interventions and treatments and to choose the best course of action for the patient. This is particularly important in difficult end-of-life care decisions such as withholding and withdrawing life-sustaining treatment, medically administered nutrition and hydration, and in pain or other symptom control. The principle of autonomy is defined as all persons have intrinsic and unconditional worth, and therefore, should have the power to make rational decisions and moral choices. Each individual should be allowed to exercise his or her capacity for self-determination. In certain instances this principle may be overridden, such as if the autonomous action of a patient causes harm to another person and individuals who lack the capacity or competence to act autonomously, such as infants, children and incompetence due to developmental, mental or physical disorder. The principle of autonomy encourages physicians to disclose medical information and treatment options that are necessary for the patient to exercise self-determination and supports informed consent, truth-telling, and confidentiality. The requirements of an informed consent for a medical or surgical procedure, or research, are that the patient must be competent to understand and decide, receives a full disclosure, able to comprehend the disclosure, acts voluntarily without external influence, and consents to the proposed action. Competence for an informed consent is defined as the patient's ability to state a preference or choice, understand one's situation and its consequences, and finally the ability to reason through a consequential life decision. Truth-telling is a vital component in a physician-patient relationship. Without this component, the physician loses the trust of the patient. An autonomous patient has not only the right to know of his or her diagnosis and prognosis, but also the option to forego this disclosure. However, this does not have to be a binary choice, as the patient, in exercising this right, may authorize a family member or members to make decisions for him or her. Physicians are obligated not to disclose confidential information given by a patient to another party without the patient's authorization or permission. Individual physicians must refrain from discussing patient specifics with their family members or in social gatherings and social media without prior permission. There are some exceptions to patient confidentiality. These include specific legally required reporting of situations that may cause major harm to another, such as infectious diseases, crime, non-accidental injuries and domestic violence. Justice is interpreted as fair, equal, appropriate distribution of healthcare resources and treatment of individuals. These distribution are based according to need, effort, contribution, merit, and free market exchanges. Each principles are not exclusive, and can be, and are often combined in application. Hence making it difficult in choosing and balancing, to form a coherent and workable solution to distribute medical resources. In summary, the four principles of ethics is to be taken as an obligation that must be fulfilled, unless it conflicts, in a specific instances with another principle. When faced with such a conflict, the physician has to determine the actual obligation to the patient by examining the respective weights of the risks and benefit based on both content and context. Thank you for watching and see you next time.